A need not only exists, but is growing bigger every day, and it is dramatically affecting one of the most economically influential groups on the planet, the baby boomers. But it doesn't end with the boomers. It's a need that has crossed generational lines and global borders. The need is health and wellness. Health in America has been steadily declining over the past few decades, even though the United States spends more on healthcare than almost any other country on Earth. Chronic conditions affect nearly half of the adult population, and their prevalence has increased in recent years. This trend among U.S. adults is a cause for concern. More than a quarter of all U.S. children have a chronic health condition, a significant increase from the rate seen in earlier decades. 1 in 3 U.S. children will become diabetic. There is a diabetes epidemic. The implications are frightening. A 10-year CDC study found a dramatic increase in the number of seniors with 2 or more chronic conditions. The increase was seen across genders, race, and socioeconomic status. The Alzheimer's Disease Facts and Figures Annual Report finds that the costs associated with the disease, both human and fiscal, are growing at a disturbing rate. America is dying to get healthy. Yet people being and staying sick is big business. The pharmaceutical industry greatly influences the American healthcare system, in some cases encouraging physicians to help them create lifelong customers to the medicated treatment of symptoms. Wellness in America is competing with an industry that thrives on sickness and disease, not health. Is a doctor prescribing a certain drug because it's what's best for the patient or because the doctor is getting paid? America is also suffering from exposure of toxins, pollutants, hormones, artificial preservatives, and other substances. Studies suggest this exposure is compromising the immune system and speeding up the aging process, a reaction experts are calling accelerated cellular degeneration. People are searching for ways to improve their health, and many people have discovered the incredible health benefits of simply drinking more water. Dehydration is a major contributing factor to many minor health conditions, like headaches, fatigue, constipation, and sleeplessness. But it has also been linked to chronic illnesses like kidney disease, diabetes, adrenal gland disorders, and cystic fibrosis. Studies have found that nearly 90% of Americans are dehydrated. The body is made up of over 70% water, so the connection between water and health makes sense. But can adopting a regimen of increased water consumption really help improve health? That all depends on the water. Unfortunately, the nutritious and healthy waters that once flowed from the mountains are just not what most of us get anymore. Instead, most Americans have turned to bottled water. Millions of dollars are spent each year convincing consumers that bottled water is the way to go, and bottled water has become big business. Some bottled waters actually cost more per gallon than premium gasoline. But excessive cost isn't the biggest downfall to bottled water. Toxic chemicals leached from plastic bottles is of growing concern, as well as the environmental impact of producing and disposing of billions of water bottles each year. Beyond cost, leaching chemicals and environmental impact, bottled water may actually have a negative effect on your health. When the pH of the body becomes overly acidic, we enter a state known as acidosis. Most bottled waters have a pH level below neutral, which is considered acidic and may contribute to acidosis.